I'm Julianne Moboon with Drugstore News. Today we have Alita Postell, Senior Director of Specialty Pharmacy Business Development, and she's here joining us today to discuss Walmart's HIV-focused specialty pharmacies of the community. Alita, thank you so much for joining us.
Thank you for having me.
Yeah, of course. So back in June on National HIV Testing Day, which is June 27th, Walmart announced the opening of 70 new HIV focused specialty pharmacies of the community. And they're in locations around the country where they were chosen for Walmart's ability to make an impact among those who need it most. So I guess my first question is, why is it the right time for Walmart to expand the number of HIV focused specialty pharmacies of the community?
So there's been a number of advancements over the years, over the last decades, on therapies and services and resources. However, as you know, in the United States, there's still 1 in 3 people that are living with HIV that are not on treatment. So we felt that we were well positioned to partner and address the epidemic and really provide the right resources and education and care, especially where we sit. So 90% of our population are within 10 miles of a Walmart. And so knowing that we can provide the right services at our locations, and we have a pharmacy team that is enabled and are already working to provide the right care to the customers that we're serving, we felt that this was the right time for us to step up and really address what we're seeing with HIV.
Sure, absolutely. And kind of building off of that, how are, pharmacists, technicians, and, community health workers working together to help HIV patients navigate their healthcare journey?
So we realize care has to happen across a number of continuums. So our pharmacy teams are very educated in HIV. We have partnered, as you know, with the Elton John's AIDS Foundation to provide training by Duke. And so with our teams, they've all gone through mental health counseling. We also did motivational interviewing because we wanted to make sure that they were getting the right soliciting the right question, or having the right questions and getting the right answers from patients so that we can address their care needs and understand where they may have gaps in care. But then also addressing it beyond just dispensing. So with our community health workers, they're addressing barriers such as transportation, housing needs, even food. So we wanted to make sure that when we were standing up our specialty pharmacies of the community, we had the right care group, which is an extension of the patient's provider, to address the needs that we know the patients had, and making sure that they can stay adherent to therapy, but then also, are they living a better lifestyle with the right resources? And so our pharmacy teams have been educated to make sure that they're addressing that with the patients.
Sure, absolutely. And you just mentioned this. So Walmart has been working with the Elton John AIDS Foundation. What have you learned about the scale of problems and barriers that still exist within the HIV community? And just kind of building off of that, some of Walmart's solutions as well.
Of course. So even though advancements have been made, there's still the stigma that's attached, and there's still a need for those that need resources. And so what we've learned is, what is our community engagement? What should that look like? So at all of our SPOC, all of our grand openings, we partnered with community leaders. It ranged anywhere from schools to any nonprofit organization that we felt would be a great collaborator with us to provide the right resources, so including testing at all of our SPOC locations. If we had a partner that could provide testing and resources, they were there with us. And then what we've learned is that you can't just stop, like we said before, with just the dispensing, extending that to the community partners, engaging our community health workers. We wanted to make sure that we were addressing any barriers we felt to care. So if the patient needed a ride and they didn't know about grants available for transportation, how do we connect them? So it's more not just testing them and educating them, but then connecting them to the care that's needed to support their needs. And so doing that at the community level with the right community partners, we've seen a lot of great success with the launch of our SPOCs.
Sure, absolutely. And also, too, what range of patient-facing services does Walmart provide to the HIV community? You kind of already mentioned it, but I was wondering if you could maybe build on it a little bit more.
Sure. So at any of our pharmacies, we have industry-leading clinical services. And so the services that we're providing, mental health counseling, nutrition, how do you live a healthier lifestyle? But we're also addressing the needs if they understand what our services are, such as immunizations. Are there things that we make sure that they understand? We have our Walmart Wellness Days. Do they understand that they can come in and get free services? And so it was important for us, for the patients that were coming in and for those that were coming into our SPOCs, to understand about the wide range of services we provided and making sure that they see Walmart as that one source for their health destination, but then also as a continuation of care from their providers. We also address insurance needs. So if someone had a gap and they didn't have the appropriate insurance services, we also were linking them to get coverage so that they can get the services or the prescriptions that they needed to care for themselves.
Great. I think those were all of my questions. Thank you so much for joining us today. We really appreciate it.
Thank you.